Hello, everyone, and welcome to Cerving Conversations, an intimate chat about self-care and cervical health. I'm your host, Brii Renee, straight from the A, and I am so excited to be here with the amazing and talented Ciara and our special expert guest, Dr. Jessica Shepard. It's all a part of the Cerving Confidence Initiative that empowers and encourages Black women to protect themselves against cervical cancer through education and screening with PAP and HPV tests. That's right, y'all. We about to normalize this type of conversation today. All right? It's all about serving looks and serving confidence, which means women finding power in taking care of themselves and their cervical health. This is a powerful because it's a partnership with one of my favorite organizations, the Black Women's Health Imperative, and Hologic's Project Health Equality, which directly addresses the barriers that prevent Black women in the U.S. from receiving the same quality of health care as white women. But before we get into it, I must shout out our amazing vaccinated audience today. Hey, ladies. I am so looking forward to you all being a part of the conversation as well. So let's get started. I want to bring out Dr. Jessica Shepard. She is a board-certified OBGYN, Chief Medical Officer of Very Well, and the founder of Sanctum Wellness. Let's welcome Dr. Jessica Shepard. Hi, girl.
Hi,
Welcome.
how are you? I'm so excited to be here, a live audience, and having this type of conversation with you and Ciara. We want Black women to know that their health matters.
Yes. So now I want to introduce someone and welcome someone who really doesn't need an introduction. She is a Grammy Award-winning singer and songwriter, entrepreneur, and philanthropist. During her 15-year career, she has sold over 23 million records. But it's her role as a wife and mother of three that is always center stage. Y'all join me in welcoming Ciara.
Hey, good morning, ladies. Good morning, everyone. I'm so excited to be here with you all today. I'm looking forward to this conversation we're going to have.
Yes.
Absolutely, it's going to be fun. We're going to get some engaging commentary, and we want to hear from you as well.
This is so important, you guys. I'm so excited to be having this conversation. But first, Ciara, I want to ask you, how are you doing? Because we see you everywhere being a busy wife, a mom, and you have a successful career. You make it look so easy. Is it really that easy?
You're so sweet. I will say being a mom is a job in itself. And then obviously having work, my hands are full. I'm literally like, okay, when do I get to sleep? But honestly, I'm grateful for it all. My family means the world to me, and they're a big part of my reason why I love life. And that gives me the energy that I need to thrive in every other area in my work, in the workspace and beyond. So I'm doing really good. I can't complain. I think the greatest thing is just realizing when the opportunity is there at the door, you got to go after it. And so I want to go after every opportunity that is out there for me, and I'm having a good time while doing it.
Yeah, so I know that you realize the importance of self-care and the benefits of self-care. And we've been seeing with this Cerving Confidence campaign, you've been talking a lot about the fact that screening for preventative diseases like cervical cancer is also an important part of self-care. So who in your life first encouraged you to be more inclusive with your self-care routine?
Well, I say years ago, one of my closest friends, Yolanda, who actually is my makeup artist, she's actually my best friend. I've known her for almost now 21 years. My birthday's coming up. I don't want to do the math, but we've been friends for a long time. And she was one of those women that I looked up to that was all about self-care and taking care of yourself. And I was inspired by just seeing that. She was always on top of her stuff. She still is to this day. And I think there's something cool about us, being on top of our game. I think that's how we continue to level up. Is there's nothing better than knowing your health status, right? Mm-hmm. And for me, I think also being a mom really encouraged that side of me to come out and to push myself more in that space and be more on point, because I really want to be able to witness all the special moments that my kids are going to have and that we're going to have together. And I think the way that we do that is being on top of our health game. That's probably the number one priority. I think of how we can have a true successful life. We have to be on top of our health game. So it's a little combination of things like that. that I think really, pushed me to be on top of my game, my health game, and self-care.
For sure. So, Dr. Shepherd,
Yeah.
I want to talk to you a minute because it's been a crazy year and a half, with COVID, the pandemic, and everything. So, how has your life been in your self-care routine?
Yeah, when we say the word self-care, I think sometimes people think just doing little things for ourselves, like a manicure, a pedicure, which I think is definitely contributory to self-care. But self-care really requires trying to build a legacy, whether that's for yourself or your family or your kids, and that requires taking care of your health. And so self-care really means being present in the moment, acknowledging who's around you, what's around you, but also taking the time to invest in yourself. That's true self-care, investing in yourself, and that means investing in your health. And you can do that through various ways. Obviously, today we're talking about preventative ways to do that with your health. So that's what I really look at it as, being present, but also investing in yourself to create that legacy.
Yeah, so when you counsel some of your patients, what are some ways that you encourage them to practice self-care?
Yeah, I think self-care comes in the form of how can I make an investment to me, my community, my family? And so I always want them to know that health, it sometimes can sound scary and intimidating, but health really comes with overall health, with taking care of your social part of your health, your emotional health, your sexual health, and also your physical health. So it really is a combination of everything that contributes to that self-care. I kind of like to call it like that pocket of self-care, but you really need to invest and pour into all of that to really get the true outcome of self-care and overall health.
Taking a holistic approach.
Absolutely.
I like that. So, audience members, now we know self-care is a very trendy topic right now in the media, but if we expand it to things like including our PAP tests and regular screening, let's be real, how well are we really staying on top of our self-care routine? By the show of hands, how many of you feel like the pandemic really hurt your self-care routine? Anybody want to share?
Hi, I'm Cheyenne Parker. I play for the WNBA Atlanta Dream. And I think the hardest transition for me with dealing with self-care and just with COVID and the pandemic was mainly just adjusting as an athlete. I'm 6 months pregnant, and I caught COVID when I was like 3 months pregnant.
Wow.
And it was a really stressful time. It was also the beginning of the season for me, so it was just so much that I had to endure just with my overall just mental state. It was a very depressing time, and it was just a lot going on, but I'm looking forward to a conversation like this, just from such an amazing woman, a mother who has been through this pandemic as well, and to hear from such a great educated doctor as well.
Thank you for being here.
Yes, thank you. So, Ciara, what's it been like for you trying to keep up with regular scheduled doctor visits during the past year with COVID and social distancing?
I will say, being pregnant during the pandemic was definitely an adventure, to say the least. I kind of felt like the four walls are coming in on me because you're literally trapped in the house every day. You can't go anywhere. You're being extra cautious because you're pregnant. And so that adds another layer of like just craziness in the mind. I'm like finding all kind of ways to be creative. Russ and I would have date nights in different parts of the house, like finding ways to just do. I was in my kids' Zoom classes, and Sienna was 3 years old then, and she was all over the place. We couldn't last more than 15 minutes in a session before she's grabbing on curtains under the desk, just doing all kinds of stuff. But as it related to my healthcare during that time, and just even in general, I will say I'm a stickler for it. And I do think, when you are pregnant, you have to have those visits, which, I think was a blessing because I really had a reason to be in the doctor's office. And, I think that I was able to really be on point because of that, if that makes any sense. But I will say I've created this commitment to myself, when we talk about self-care and, really, I think self-care is the best care, and that's also the way that we love ourselves. We have to make sure as women we're pouring into ourselves. And that's in every way. And I know Dr. Jessica talked about it too, in the many different ways that you can pour into yourself. But that's so important that we're like feeding ourselves. Like if we take care of ourselves, and if you're a mom, take care of you, then you're taking care of your kids, because when we're good, we're able to be our best to them. So for me, I think the greatest thing is, I also have to give love to my doctor, Dr. Sabina, who also became a stickler for me with not only the annual well woman visits and doing the testing, doing the HPV, testing and all that good stuff. But also I do my EKG test every year. I do, I do the full body. We do the blood, we draw the blood, we check the vitals. And there's no better feeling than leaving the doctor's office and knowing that I checked off one of the most important boxes in my life. And so I think that once you start to like get in the habit and create a rhythm, before you know it, it doesn't seem as annoying as it is. 'Cause I don't know about you guys, but for me, years ago, especially when I was younger, it was just something about that process of going to the doctor's office and you're like, ugh, like it's just so irritating. For some reason, I don't know what it is. It happens so fast, but it's so irritating to do our well woman visits. I don't know what it is about that process. And then for me, to be honest, I think I also have a cool relationship with my doctor. I found ways to make this, like when I'm going to get my checkup, it's actually a good experience. So I think it's cool too when you do have a good relationship with your doctor. I want to encourage people to have that. I don't know about you, Dr. Jessica, but I'm sure you probably have many clients that you see that you have a connection with. And there's something about that experience, especially with women, that when we're in there, like you feel that sisterhood and you're doing something that's really personal, what's really important. And then it becomes an okay and cool experience. So I want to go back to Cheyenne and say, I just commend you for, I'm assuming you kept faith in the time where you learned that you had COVID while being pregnant. And I think it was so amazing that we learned through, moments like that is how resilient we are as women and how God has made our bodies and how God has made us to, we can make it through anything. Like if you have faith the size of a mustard seed, you can move mountains. And that's a real thing. So I want to commend you on being encouraged, because I can only imagine what that's like being pregnant in your 3 months and then you get COVID and you're playing in the WNBA. Like that's a lot to take on. Like that's a lot, especially when you're pregnant, you're hormonal, like there's so much that goes on in your mind, but God made you for every moment that you're going through, right? Yeah. He made us for every moment that we're going to go through in life. And if we can embrace those moments and we can persevere through it all. So I did want to say that, but again, going back to answer your question, I will say, if you can find a good relationship with your doctor, that can be huge. Even if you may not have the deepest relationship with them, just be excited about loving on yourself. When you do your well woman exam, you're loving on yourself. You're pouring into yourself, which is going to allow you to pour into the universe at your best.
Thank you, Ciara. And I did see Tania raise her hand. Tania raised her hand and wanted to share. Tanika raised her hand and wanted to share a little bit about how has your self-care and routine doctor visits been practicing through COVID?
Yeah, thank you. Can you hear me?
Yeah.
Thank you so much for the question, and thank you to Black Women's Health Imperative for hosting today. Thank you, Dr. Shepherd. Thank you, Ciara. Thank you, Brii Renee. Just wanted to say that because it's so important for us to be having these conversations. When I think of my self-care through COVID, I think about what Dr. Shepherd said earlier about the holistic view of your body and how you're taking care of yourself. For me, through COVID, therapy has been really, really important.
Okay.
And I think in our community, too, we really need to consider therapy more and talk about it more frequently because it can really be a game changer in your overall self-care.
It definitely is. I started therapy during the pandemic as well, and like you said, game changing. So Dr. Shepherd, I want to come back to you. How do you ensure patients feel comfortable when coming to a doctor visit for the first time or during this time, during the pandemic?
Yeah, I think, I take it two ways. One, I'm a gynecologist, so when people come to me, obviously, they're not necessarily wanting that to be on the top of their list, but we find ways to make it comfortable and fun and exciting. And Ciara alluded to that as well, really a partnership when you go to your doctor. I think, too, for women, it's a very vulnerable type of exam and reason why they're coming to see me specifically. So I do try my hardest to make that connection, because connection is everything. And then people feel invested in the relationship. So one, that takes the pressure off of me, trying to give everything to the exam, but I'm like, I want you to take part in this as well. The more of a partnership that you have with your doctor, the more that you're more likely to go back, want to go back, or encourage your family and friends to make that transition into having habits and routines. As humans, we are creatures of habit. And so if we can formulate good habits very early on when it comes to our health, And I say that very deliberately because we all have habits. We have habits of what we like to eat and what we like to wear. If we could make that same commitment to our health, you will find that you get so much return on your investment with your health. And there, again, we're talking about cervical cancer specifically today. When we think of cervical cancer, it really is impacting our Black community just so distraught when we talk about some of the statistics a little bit later. But we have a way now when we go for our routine exam with someone that we find is invested with us as a healthcare provider in that journey, we know that we can decrease those rates of cervical cancer diagnoses, but also deaths. And I think for Black women, that's really important. We have a lot on our plates. There's a lot just socially and mentally that we take on that maybe not a lot of other women from other races have to take on. And when we think that we're more disproportionately going to see a higher incidence of death, those three together alone should make all of us here want to run to our doctor's office and be like, you know what, I am going to be consistent with my Pap testing. I'm going to know what it means, knowing what the results mean when they come back, and not just being like, yeah, I got it done. And then also encouraging the people around you to take on that exact routine that you are doing for yourself. It's all about self-care and making sure that you invest in your health.
Yes, I think that's so important, like you said, building that relationship with your healthcare provider, because it's like, hey, I want to get to know you a little bit before I bust it off.
Yes, and here's what I would say, like even if you do bust it out, okay, well, right. Go there. If at the end of the visit you're like, you know what, I'm just not feeling that. I tell patients all the time, if we don't form that bond and if you feel that I'm not the person for you, I am quite fine with you finding someone else, because I want you to be in charge of your health and empowered by it. Yeah. And I quite invite that, because I think that sometimes that patient-physician relationship feels so loyal that people feel like they have to stay with their doctor no matter what. And like deep in their heart, they may hate them. I'm like, well, go find someone that you can relate to and talk to and want to have more insightful conversations with.
That's so important, taking charge. So Ciara, this seems like the perfect time for the Cerving Confidence campaign to have launched. What excited you about joining this initiative?
Well, I think being educated on, understanding how cervical cancer has, as Dr. Jessica talked about, has impacted Black women and Latina women, and just understanding the numbers on it all. Black women are 2 times more likely to die from cervical cancer. When I heard that, my antennas went up. And then I also looked at the opportunity with my platform to educate my Black sisters and, educate everyone, really. I think when you understand this, it's game changing. And what's also really amazing is that what you learn is that it really can be prevented, and it also can be cured. Right. So I think people don't realize, like, if you go to do your screening, God forbid you discover you have cervical cancer, you can actually tackle it. And then you're able to live, you're able to thrive, you're able to, continue on your legacy. So when I learned about all the details, in regards to cervical cancer and this really cool campaign of Cerving Confidence, I was in. I was excited. I love the idea of serving confidence. It's like you said in the beginning of the conversation, like, let's make this an easy conversation. Let's make this a fun conversation, right? If this is us women coming together, and there's nothing better than being able to have our community that we have with each other and being able to keep it real with each other. Like I mentioned earlier, I know myself, especially when I was younger, going into the doctor's office was just an uncomfortable thing. Like, it was just weird. And then I just flipped the switch and I came a bit obsessed with taking care of me. And I found a way to love the process. And I just make that appointment easily and I go and get it done. Like I said, great relationship with my doctor does make it fun. But more than anything, I feel good knowing that I have crossed my T's and dotted my I's, and that all my boxes are checked in the most important areas of my life.
Yeah.
It's like almost like you're like seeing the path that you've built.
Yeah.
And you have these building blocks and you're like, I'm going to take care of my health. I want to make sure that my kids are taken care of, that my family or my husband or spouse or partner is taken care of. That really kind of builds this foundation and where you can prepare better for the future. And I love that you put the health into that perspective of being obsessed with it. I love that you're obsessed with it.
Yeah.
And you kind of know what's coming down the pipe because you've put in the work before. So it's putting in the work to get the investment, and then you just feel better about yourself. It's so much pressure off of how you feel about yourself, and the fear kind of fades away.
Yeah, and I have to thank Black Women's Health Imperative, because joining this initiative myself, it made me realize, like, hey, I've skipped out from the pandemic, a whole year of routines, and it gave me the confidence to when I scheduled that appointment, I actually preferred, I said, hey, I want a black woman doctor to be my OBGYN, because usually they'll put you with whoever's available.
Yeah.
But I specifically asked for that, and like you said, that relationship that I built, it just made me feel more confident in continuing the healthcare and the conversation.
I love that you kept saying confidence. It's just like a pun on words. You're like, I'm going to serve confidence for my
yes.
pap test here.
Yes, I'm serving
Exactly.
confidence when I request that black woman doctor. So, Ciara, you filmed a PSA for this amazing campaign. Why don't we go and watch that video?
I get it. You're busy being a boss at school, work, or home. But no matter how many boss moves we're making, we must boss up and remember to take care of ourselves first. Serving looks starts on the inside.
Let's normalize being on top of your stuff.
Schedule routine well woman exams with a doctor to stay on top of your health and screen for things like cervical cancer with PAP and HPV testing.
It's preventable, so go catch it early.
So let's serve our looks and ourselves and make sure we're serving confidence when it comes to our health. Visit bwhi.org to learn more about cervical cancer screening.
We made our appointment, now you're served.
Yeah, give it up. That was an amazing video. Ciara, what was your favorite part of shooting that video?
Well, it was pretty fun. It was pretty easy, what I will say. But it was a good time. I think for me, really just being a part of the campaign and having this opportunity to use my platform and speak out. And then obviously, I think seeing all the girls come together, I think I enjoyed that more than anything because I got to see other women like myself. And I got to see us coming together to spread this important message and to encourage other women out there. And I love those kind of moments. Like that's my jam. You know, I love getting together with women and talking about real stuff. And then also being able to use my platform to spread that word. So I enjoyed it. The team was amazing. You know, I will say the whole squad was awesome there. And so it was a fun shoot all around.
Yes, and we have Kiva here. She was a part of that experience in that video. So what did you learn from that experience of working with the video, and how has women's cancer affected your family?
So I will say that during the production on set, I learned that cervical cancer is preventable and it can be cured. That's something I was not aware of. None of the black women in my family have been affected by cancer, but my grandfather actually did pass away from cancer. But it's nothing new for chronic disease prevention to our family because I'm a type 1 diabetic myself. So prioritizing my health and just staying on top of everything is like so normal for me. I go to the doctor every 3 months. So building that relationship with my doctor, I've had the same doctor who actually diagnosed me, so that's very important. So I actually love her. I look forward to going to see her. So important.
I love that. She's obsessed just like you, Ciara.
Yeah.
I love that.
I love this.
I could feel her energy. I think that support's amazing. You know, I think like, you know, my doctor, she comes to our house. We're that close that she's at our house sometimes with my family. She was actually one of my bridesmaids. So that's how close we are. And that obviously happens over time. But I loved hearing this sweet young lady just now speaking about, you know, that relationship. You could feel it when she was speaking. And especially considering, you know, having type 1 diabetes, which I also am familiar with. I have someone in my family that has type 1 as well. And I also unfortunately lost someone to diabetes. And also my husband, he lost his father to diabetes. But I can only imagine that support that you feel when you're having your appointments. You can see the joy on your face when you were talking about that. And I think that's beautiful when you can have that relationship.
Yes. So any of our audience members want to share with us what you liked most about that video?
Hi, my name is KO, the entertainer. One thing that I really liked about the video was that there was a masculine presenting woman in the video, such as myself. A lot of times it's hard to see us in a positive light. And a lot of times when we go to the doctor, it's kind of nerve wracking. One, because, you know, it is pretty nervous, you know, kind of, like you said, busting it open. But for me, being a masculine presenting woman, it's being labeled or automatically assumed that I'm a man when I walk in, so it makes you automatically on guard or uncomfortable. So just being able to see that kind of puts my mind at ease, and just lets me know, like, okay, maybe this won't be so bad if, you know, if I do build the relationship with my doctor, just like you said, Dr. Shepherd. So it's something that I'm looking forward to.
I love
Yay.
hearing that.
Amazing.
I love that.
Yes.
So let me just say something, KO. You know, sometimes when we try things in life, people are going to question us, and they're going to question us in many ways. And I just want to encourage you that no matter what, when you're taking care of yourself, stay on that mission, go in there and be confidently you and go on with your plan. And it's like, you know, I think about that just in life in general. Like, you know, I think we have to have that attitude. Like, people are going to sometimes question you, like, no matter what gender, no matter what it is. Like, I experienced being questioned myself in many different areas of my life. But I think what I've been able to really tap into is like, I'm going in for me. And something else I thought about too is like, investing in your health is investing in your wealth. Health is wealth. So with that being said, go in on your mission, no matter the circumstance, and be committed to that and be confidently you. I just wanted to say that to you, you know?
Yeah, you know, one of the things about the video that I found, again, was very inclusive. And I think that's very important, especially for our community, because many times the social stigmas that may be held against whatever, I mean, it could really be a range of things that we hear in our communities. You know, even for me, from personal experience, we were talking a little bit earlier about just kind of that habit forming, going to a gynecologist. Many times that comes with the sexual stigma of, why do you need to go to a gynecologist unless you're sexually active, and you shouldn't be sexually active, and all that comes with that. And you know, that goes with a lot of religious, also family foundation and messaging that goes through our communities that can actually hinder our health. So these, you know, this video specifically, Cerving Confidence, allowed a lot of inclusivity. It also allowed to break down the barriers that a lot of women feel about going to the gynecologist and why they're going. And really, I find that the messaging was so important. Someone here, I don't remember who had mentioned it, but that they didn't know that cancer, specifically cervical cancer, can be not only preventable but curable. Early detection is key. We say that mostly about cervical cancer and breast cancer, but that's why we want you to go. The word cancer in general is very fearful. People are like, they think cancer and then they think the worst case scenario. I'm like, stage 3, stage 4, terminal. That usually comes associated with that word cancer, but we have really come so far in technology and medicine that we now have a way to cure certain cancers if it's detected early. So that comes with prevention. Prevention is key, and early detection is crucial.
That is. So Ciara, we heard some of the ladies in the video say how they were affected by a family member with cancer. Have you had anyone close to you deal with a women's health cancer issue?
Yeah, actually someone on my team experienced cervical cancer, and she had it. And I remember her nerves being really high and watching her go through the process. But she was one of those women that she was on top of her stuff, and thank God she was cured. So I do remember that moment, and you know, and it was very real. But again, Dr. Jessica's point, and what we're talking about is it's a relief for people, I think, to know that it can be cured.
Yeah, you know, those numbers, I think, I always like to give numbers when we're talking about certain disease states. For cervical cancer, every hour a woman dies from cervical cancer.
Wow.
Every hour. And I like to make those not to scare people, but to be like, okay, those don't sound so great. That statistic is not great, but I actually have a tool that can help me not necessarily be someone who could be in that statistic. And also disseminating that information to your loved ones, your families, your friends, making it like a girl date. That's self-care right there.
Yeah.
How about we make a date with my girlfriend to go get our pap test?
Yeah.
Okay. You can do happy hour after, but not before. Make sure you do it after.
Okay.
And then the other thing is that how that impacts our community. 2 times more likely to die from cervical cancer. So we already know the rate of how many, you know, die an hour. 1 dies an hour from cervical cancer, but also it's preventable. It's actually curable if we have early detection. And we want those rates in our Black community to go down. We can empower ourselves in our community. We're such a strong voice when we are together. Black women, you know, you've seen in the last year what we can do with our power and our voice. We should do it for ourselves when it comes to our health.
Yes. So, Dr. Shepherd, you just mentioned briefly about how common cervical cancer can be, but if a woman is not experiencing symptoms,
Yes.
should she still be concerned about cervical cancer?
Absolutely, and that comes with the early detection. I think, again, you know, when we think cancer, we're thinking it has to come with a symptom, or have to feel a certain way, or have to feel sick. That's when it's late stage. Early stage really can come in the form of some abnormal cells that might be picked up on a pap test. Knowing when you should start your pap testing, which starts at the age of 21. So you want to get your pap test at a regular time frame from 21 to 29. At the age of 30, because you've empowered yourself, everyone here, and we're going to go tell everyone, at the age of 30, you're then going to say, I would like the pap plus HPV testing. That's co-testing. HPV is the human papilloma virus, and it is the most common cause of cervical cancer. So if we can detect for HPV, you know, coming from a physician standpoint, it is so helpful for us. We can guide you, we can help figure out what needs to be done next, but we need you to come in, and that's why it's so imperative that we start with our screening early. We continue with it, follow the recommendations, and then always ask for a PAP plus HPV testing.
And that is so important. I just want to share with you guys a little bit. Like I said, after being a part and brought on to this initiative, I decided back in July, like, hey, I can't tell women to go get tested, and I haven't been tested. And I went, and the last time I had gotten my PAP was at age 29, but because I had a male doctor, he did not call me afterwards to tell me that I tested for HPV. And I didn't know for 2 years. But after requesting that black woman as a doctor, she said, hey, did you know that you tested? I'm like, no, I had no idea. And so she walked me through a little bit of more answering certain questions about it and how often I should get screening now. So I want to ask you, for our audience members, what are some questions that women should ask when they go get their pap test and when they go to get their cervical screening, and how often should we be getting tested?
We start at the age of 21. You know, before it used to be a little bit earlier, people would say, oh, well, only when you're sexually active should I start getting your pap test. But it actually, we want you to go whether you are or not, because again, there comes the connotation of if you do have HPV that you're promiscuous. Has nothing to do with that. I have seen people who have been married for years, and again, having HPV, it is very common. HPV is very common, and it should not come with any stigma of how you got it, why you got it. We know it's there. I always like to tell people that dolphins actually have HPV. That makes it sound so much better. But it is detected in dolphins. They're so cute, right? The dolphins have HPV. So it should make you feel a little bit better. So it's not so much that you might have a positive HPV on your pap test when it comes back. It's so much more of what do we do with it now? That's really the perspective that we take as healthcare providers, is like, great, we have this information and now we know what to do with it. We know how to guide you, how to counsel you, and when you should come back. So starting at the age of 21, at the age of 30, starting to ask for that PAP plus HPV. I feel like we should all chant that. PAP
plus HPV. Yep. So Ciara, what can women do to learn more and protect themselves?
Well, I think to learn more, you can go to bwhi.org. You can go there, but also too, I think as Dr. Jessica's been speaking, and you know, again, having those conversations, speaking with your doctor, I think is important. You know, asking questions, you know, is important. And I also think too, you know, bringing along your friends with you, you know, bring your girls with you. We talked about this, you know, having those sessions, maybe go have a good time afterwards if you're going to take a little sip of something. Right. But let's put a spin on this thing, you know, let's put the spin on it that, again, self-care is the best care, which is the truth. But also too, like us being on top of our game and our health status as it pertains to this area, like it's good being, that's sexy to me. Like it's sexy when a girl is on top of her stuff. Like she's not only getting cute and getting fly, she knows what's going on inside. Like I think that's really important. I try to rhyme, by the way. But you know, that's also really important. So there's nothing better to me than when someone has their stuff together. Like I think about it, when I look at my husband, like beyond what he may do that people see him do, like I see the level of consistency that he raises the bar to how he wants to do things as a human, as a man. And I think that's sexy. So I'm like, okay, I can only imagine what he would think if I'm on top of my stuff. Yeah. Right. So I think that, you know, whether it's a man in your life or not, like there's just something sexy and attractive about you being on top of your A game. And as it relates to this, like, let's put a pull on this thing. Yeah. And I even like hearing us talk, like, I love this conversation because sometimes I think it takes women hearing other women like themselves. Yeah. You know, like, I think that makes a difference. Like, it is cool to go and go to get your pap test. It is dope to like really know your health status. Like we out there jamming in the club, you know, doing our whole thing. We can go out and put that effort to get ready, but there's nothing better than knowing like what's going on within yourself, like within yourself. So that's what I would have to do with that.
Yeah. So of course we want to make this experience engaging. So I would love to go to my audience and get some questions from you guys. First up.
Yes. Hi, ladies. My name is Jeanne Epps. I'm the director of the My Sister's Keeper program, as well as the Positive Period program for the Black Women's Health Imperative. And the My Sister's Keeper program is all about empowering young Black women to be advocates and leaders for their own health and well-being, as well as that of other Black women. So my question to you, Ciara, you are so empowering through your music, through your energy. Was that something that was always natural for you?
You're so sweet. Thank you so much. I will say I was an excited little girl since I was little. I didn't have much growing up, but I've always loved joy. I was just talking to someone about that. Like, joy is so important to me. My joy and how my soul is being filled is really important. So I will say I try to commit to that theme, and that kind of helps me to like stay balanced when life is not so balanced. And when it's off, it's like, how fast can I get to the place of joy? You know, that's kind of been a big part of my thing. And it's a commitment that I've made for myself on the spiritual side too. I know some of you guys may know I'm pretty spiritual too. So, you know, having Jesus at the center of it all is really important for me. But I will say, like, I've been that one, like, I love laughing. I love smiling. I love a good time. Like, I love energy. Like, it feeds my soul and it allows me to go out and really like enjoy life. You know, like life is so precious. So I think for me, it's like, how do I maximize every moment and opportunity? How do I make the best of life when it's not so good? Like, I gotta get to joy. How fast can I get to joy? Like, that's a big part of my like drive in life.
I love that, you know, hearing from you, from someone who's so successful, has done a lot. I'm sure everyone in here is like, that's Ciara right there.
Yeah.
To hear that you still have moments where you're like, I have to find
my joy,
means that you have moments where you're like, it's not always together, y'all. I have some moments that are right. And so what you do in those moments is very insightful for all of us to be like, we all share those moments that are not so great. But what can we do is, again, looking at you, we're like, well, I'm going to do what Ciara did to find my joy.
Let me go find my joy.
And listen, don't let nobody steal your joy.
Yes. Yeah.
Okay.
Your joy looks beautiful on you, Ciara. We can see it radiating. Let's go to the next audience member. You have another question?
Yes, hello. My name is Dominique. First and foremost, I want to say I'm grateful for being here. And my question is actually for you, Dr. Shepherd. So I heard Ciara touch on this. And, you know, my question is cervical cancer something that is a larger problem for Black women? And if so, why is it that we seem to be, you know, affected at higher rates?
Yeah, you know, that's a question I get very often, but healthcare disparities, that really is something very focal. Being a Black female physician, there are only 2% of the entire medical community that are Black female physicians, so there's not many of us.
Wait. Say 2%?
2% of the medical community are Black female physicians.
Wow.
So, again, these types of conversations inspire people to go for, you know, medicine and for healthcare, and we need more of you in the field. But the reason why that's important is because we are seeing this disparities, whether it has to do with socioeconomic issues, access to care. Access to care is probably one of the biggest things that we've seen is when people do need that care, where do they go? Yeah. How long does it take them to get where they need to go to get that care? And if there's follow-up that's needed, do they have to take off work? Who's going to take care of the kids? There's so many things that factor into that. And then also education and awareness. You know, we've heard it today that cervical cancer can be prevented, that was an unknown, that it can be cured. And there's so many different little facets of the information that we get, the information that we retain, and how we actually use that information. So it really is kind of multidimensional when we think of why we're seeing that. But I think that conversations like this, serving confidence, having intimate conversations with Ciara, I just put you in there, that means we got to have more intimate conversations with her. But this is the type of community that we have to build in order to thwart that misinformation away, to heighten education and awareness, and to empower ourselves to do the best for us and our community. I feel that women are the nucleus of our communities, our families. We're the ones who are taking care of everyone, making all the doctor's appointments for everyone else but ourselves.
Yeah.
And we really need to, again, shift the focus to how can we collectively get that information out so we can stop seeing these disparities in our communities. Great question.
That's a great question. We're going to go to our next question in the audience members. Here we go.
Hi, my name is Crystal Jordan, and I am the women's editor for Rolling Out magazine. My question is for Ciara, because we talk to so many women, and I think so many women see you as such a positive role model. You have, it looks like, everything together from family to career, spirituality, and now, of course, health. What would your advice be to a woman that's trying to level up in every area of her life and really isn't sure where to start?
A lot of times you can't really, find your way when it's so noisy and so much going on. So I think sometimes you have to pause and like visualize your life, like take a moment, like where am I right now? Where am I trying to get to right now? And I think that oftentimes when you like take that moment and give yourself that opportunity, you start to work your mind in the right place. Like I always say, you can't get to where you want to get to in life without a compass. Like, do you have a vision for yourself? Like, do you have a vision for yourself first and foremost? Like, even when it comes to love, like to me, that part comes second. Like, how am I loving on myself? Like, how am I pouring into me? Like, all of these things are really important. I think that when we set ourselves up for success, and we can attract all the things that we want, right? And so I think sometimes you just have to do self-reflect, like self-reflecting moments. Like you have to literally pause. And I do this in my life still. Like I'm going to tell you, like someone mentioned it earlier, like being a mom of 3, having a husband who's my biggest baby, and then work. I mean, sometimes I'm like, Lord Jesus, like, but seeing in the car, she repeated me on the way to school. She said, Lord, because I say that sometimes, but like, it's not always perfect. It's sometimes somebody poops before we go out the door, somebody steals something before we go out the door, and then I have like 40 emails I need to answer. Like, it's a lot. But I think that to walk ourselves in the direction that we want to get to in life, we have to like self-reflect. We have to pause. Like, there's a line in the Bible where God says, be still and know that I am God. And I think there's something really important about being still. Like when you're moving and a whole lot's moving, there's no way you're going to find clarity. So I think that taking a moment to be still, self-reflecting, visualizing, and then speak life. I always say that you got to speak life. When you talk, you have a chance to tell your life story. So when you speak, say great things. You got to declare great things in your life. I have learned that every time in my life when I've said I want to do something, like just throw it out there, or something that's like not so positive, I project that energy onto myself. And I found myself in a place I'm like, what the heck? But I said this is what I wanted to do like a year ago, and now I'm here. So I think that we don't understand that we don't really realize the power of the tongue and when we're speaking. So I want to encourage everyone to speak life into what you're doing. When you're going through tough times, speak life. Like I've been in moments where I'm like trying to figure out where I am. And I'm just like saying, thank you, God, like just saying thank you in the middle of the storm. And I'm speaking life in that moment. Like I said earlier, I want to get to my joy. Yeah. So I think that you can like do some of those things. And I'm saying self-reflect, pause, visualize. What's your compass? Where are you trying to get to? Like, and be intentional. And if you pray, be intentional when you pray. All of those things will add up to like getting you in that right direction. So, those are a couple of thoughts that come to my mind.
I love that you kept it simple, like, right? Because when times get really hairy and there's so much going on, if you can really have a good foundation in keeping it simple, finding your joy, speaking, positive things into your life. Sometimes when it's very cluttered, that's the beauty of mindfulness, is being able to self-reflect and bring it back down to those, I kind of call it mantras. Like, what are your own mantras that you've come up with for yourself, and reflect on those, and you really can find you can get a lot of clarity and direction out of that. And all of a sudden, all of that stuff just clears away, and you can again refocus on where you need to be.
And like you said, starting with you, that's what we can, sometimes life feels so out of whack and out of our control, but like you said, those things that you mentioned are all things that we can control. Yep. Starting with yourself, thinking inside, being clear, having vision, power of your tongue. Those are all things that you can control no matter the circumstances. Yep. So thank you for that. Let's go to the next audience member.
Hi, ladies. Thank you so much for having me. It is such a pleasure to be surrounded by so many beautiful Black women. Going back on what you said a little bit ago, Dr. Shepard, how has the COVID pandemic affected disparities?
Yeah, we have seen that clearly with the disease itself. COVID-19 has really impacted our communities in a way that unfortunately is disproportionate. We have seen, again, more deaths, more mortality, morbidity when we think of the pandemic hitting our communities. So again, that goes to what we feed our communities with information, dispelling misinformation, ensuring that we get clear messages of what is true and what's not true, and making sure that, again, as women, that we are, again, getting that message out. So when we think about disparities and what we're seeing in, the pandemic, that means that too, what we've seen is also people have not been able to kind of pick up on their annual checkups, and well women's getting their checkups, whether they have chronic diseases, and getting into the doctor. So it's kind of like we've had a reshift in what was normalcy for all intent and purposes. So now it's kind of redirecting back to getting things back on the books, such as your well woman. If you have chronic diseases, making sure that your medications are, again, up to date and taking care of those. So there's actually a lot of, I think that's a very emotional, mental perspective of things that we are not taking into account, because so many things happened and now we're actually having to reshift that. Mental wellness is so very important because we do not have that in our communities where we actually see that as a part of our actual health. Mm-hmm. And so, one of the members before, I think it was Tanika, who had mentioned getting a therapist, and Brii, even you mentioned getting a therapist through the pandemic. If there is anything that I have seen that has increased significantly at the height of our pandemic, and now we're kind of towards 20 months into the pandemic, is that mental wellness has hit a sky high. When we think of therapists, psychiatrists, psychologists, those services have increased significantly because globally our mental wellness took a hit. And so I find that it is healthy for us to focus on that. And if you can take that and use that to, again, correct and reset, you can move through mountains.
Beautiful.
Thank you for your question.
Thank you. We have one more question.
Hello, everyone. My name is Tian. I'm so grateful to be here with all of you and to be speaking with Ciara, Dr. Shepard, and Brii. So my question is, do women in long-term relationships really need to get screened for cervical cancer?
Yes is the short answer. Yes, yes, and yes again. Because, and again, I think that comes with, again, a message of people who are in long-term relationships. Well, I don't need to do this anymore. HPV actually has, and viruses in general, you see that with COVID-19, herpes, you see that with chickenpox, they're all viruses. So what they like to do is they play hide and seek. And so sometimes they're hidden. So you may take a pap test and not pick up HPV, but that doesn't mean that you don't need to go again. And that's why people think, oh, well, my pap was fine, I don't need to go again. It can come back on another pap, and that's what we're really looking for. We're just following, and we're just carefully observing. And if it comes up on your pap test, which is why it's so important to ask for co-testing, then we know that it's there, and we know to watch for it, carefully observe it, and give you the tools on what you need to do next. So yes, people, divorced, married, widowed, single, I don't care, you guys get yourself into the gynecologist or even your family practice doctor to get your pap and HPV with co-testing, because again, it's not so much about what you're doing, it's about the virus, and that's what we're watching, and it does just tricky things sometimes, so we just like to have a careful eye on it.
Yes. Everybody get your test on.
Yes.
Everybody get your test on, okay? We have one more question from our audience members.
Hello, my name is Jaya. First, I want to say it is such a blessing to be invited here. And thank you, Ciara, for your positive light and inspiration. I do have a question for Dr. Shepard. I wanted to say, I wanted to ask you, how much does it actually cost to get screened for cervical cancer?
Yeah, so when we break that down, so when we think of our preventative health screening with your annual visit, this actually means that this is, if you do have insurance, your insurance covers that as a preventative well woman testing. If you don't have insurance, under the Affordable Health Care Act, that is covered, so that should take away any of the need for a copay, deductible, etc. And then for people who, maybe are in communities and are maybe undocumented or whatever, that still should not take you away from having your well woman. There are many organizations that actually provide these type of preventative services. When we think of pap tests, mammograms, any of the things that we know are very preventative, those still can be offered. So again, it should never detract you from getting your annual well woman and your pap plus HPV. Is make sure whether you're covered by insurance, don't have insurance, or in a community that may be undocumented, you can find the resources to get that taken care of. Again, because this is something that's really going to decrease deaths in our communities.
Yes, and actually we have one more question.
Hey.
Hi everyone, my name is Danielle, and my question is for Ciara. When it comes to Black women's health, what is your wish for the future world your daughter grows up in?
Well, my future wish is that the narrative changes, that we change the narrative, especially with all this information that we're able to learn about how disproportionate it is to Black women and Latina women. I'm hoping that, by time, I don't know, at least let's do 10 years from now, but at least, I'm hoping that the narrative changes. Like honestly, as a Black woman, it's a little frustrating when you hear the same story over and over about how things are disproportionate in areas like this and others. And it is time for that to change. Yeah. And I think too, like I say, all of us being able to have this community, I encourage everyone to go and talk to friends that aren't here today. Like, pep them up. Like we said, if you got to do it together, whatever it is, like, let's get this narrative to change. Let's do this thing together. And I just think about like my daughter, I hope that by the time she's my age, it would have changed by then. And that she will see my mommy going out and taking care of herself. And that's the way that I should live. I hope that I leave that kind of legacy for her in all aspects of her life, in her health scape, in our house, we are big on health, and it is a commitment together. So I hope that she sees that and takes note of it and is inspired by it, and she'll do that. And then she'll pass it on to her daughter. She has a daughter one day. Because when you think about it, when you change the cycle of things and you're part of making that change, it's the gift that keeps on giving, because one person's affected, then they affect someone else, and they affect someone else, and so on. So my hopes is that we change the narrative. And I think it has to start now. Like, even when Dr. Shepard was speaking earlier, I was thinking about how some areas don't have access, but also be that person to find that access. I didn't have much growing up, but I wanted to know. Even in my moments of like growing, on the business side, like there's some times in my career where I wasn't exactly where I wanted to be. And even now, I'm still not exactly where I want to be. Like, I still have goals, but I'm going to find the information. One thing they would say about Lil Cece, she going to figure it out. She going to make it happen. So that was always my attitude, even when I didn't have much. And so I want to encourage my Black sisters and women to find information. Like, let's not make any excuse. There's no excuse. It's really us just getting up and making the effort and taking a leap of faith in life and our health space. In this case, like, take a leap of faith, know who you are, know your status, be confident in that. Like, so you can go out and enjoy your life, and God forbid you discover you have something going on. Thank God you took the initiative, and thank God you got up and you went to get your screening to learn about yourself so that you can be on top of your health, So that's what my wish would be, as it relates to this topic and in general.
I love that you mentioned that, Ciara, about teaching your daughter and her future daughters to come, because that is true generational wealth, generational health. So I love that. Let's continue to pass that down. Before we get out of here, I definitely want to ask you guys, for you first, Dr. Shepard, any last thoughts or information you'd like to share with our audience?
Yeah, I think that this is an opportunity, Ciara had mentioned, us taking that responsibility for ourselves, but everyone in here has information that now they can share with someone else. And if we, again, can change this statistic, if we have the ability for our daughters and our family to change that narrative of that disproportion in the healthcare disparity, we can do it. I firmly believe that we have so much to give, and we can get that back in return. But we have to do the work, and I know we can do it. We are so powerful together. Cervical cancer, again, sharing those statistics, every hour one woman dies. Let's change that.
Yeah.
We have the power, the education, the awareness, and I just wanted to thank everyone who is here to invest in their health. I wanted to thank you, Brii, for hosting the session, and Ciara, of course, thank you for being here, sharing again your knowledge, your power, and again it's kind of like invigorating. I find her very invigorating, and I know that there is going to be so much outcome from just this intimate conversation today. And also to BWHI, the Black Women's Health Imperative. They are continually changing the game when we have that health conversation. And then Hologic for Project Health Equity, allowing them to take the actual statistics and knowledge and then doing actionable items in the community to change that narrative for all types of fibroids, breast cancers, cervical cancers. So there's so much that we can take from this, and I hope each and every one of you has learned something here today.
Yes, and of course, Ciara, any last thoughts from you?
Yes, no, I mean, Dr. Jessica said it all. I just want to say it was exciting and an honor to be here with all of you ladies today, and I really enjoyed our conversation. And I too hope that our conversation will pay forward for ladies in the room, but also other ladies that we can affect outside of the room that everyone's in right now. I had a good time speaking with both of you ladies. This has really been a blessing to be a part of this amazing campaign. The BWHI team, I want to thank you guys as well, because it does take people like you all, taking that initiative to create this conversation and to create the platforms. And I just want to encourage every woman in that room to be uniquely you, to speak life, to make sure you take care of yourself. Self-care is the best care. You gotta love on yourself first before you can love on others the right way. And that means go and make your annual Well Woman exam if you haven't already. And let's make it a commitment to do it every year after that. Let's be on top of our game. Let's level up our sexy. We ain't playing no games. And the next year to come, let's go, ladies. And I love y'all.
Thank you so much, Ciara.
Thank you.
Thank you to our guests, and thank you so much to our audience for being here. I want to invite you all to visit cerving.bwhi.org to learn more about cervical cancer screening and what questions to ask at your next Well Woman visit. Together, we can make a significant progress in the fight against cervical cancer and save more Black women's lives. Thank you all for joining us. Thank you, Ciara. Thank you, Dr. Shepard, for sitting down with me. You guys are amazing.
Thank you, ladies. Bye, Brii. Bye, Dr. Shepard.
Bye.
Bye, ladies.